So my name is Megan Palmer. I'm a South African pediatrician. I'm based in Cape Town, South Africa, and I work at the Desmond Tutu TB Center at Stellenbosch University. And I was involved in developing the Union course, which is an online free course called the Interpretation of Chest X-rays in Children with Presumptive TB. And I work together with the Union to develop this course and together with colleagues here at the Desmond Tutu TB Center. Yeah, well, I think it's really wonderful for those of us who worked on the course to know that it's being used and that it's really hopefully having benefit for people. I think it really does fill a gap for clinicians, and by clinicians I mean doctors or nurse practitioners who are working in high TB burden settings and are faced with the challenge of diagnosing TB in children. There is not a single good diagnostic test for TB in children, and so these healthcare workers are obviously often having to put together their decisions around children's history and their clinical presentation and the chest X-ray to try and decide whether a child has TB or not. And the interpretation of chest X-rays in children is quite often a teaching gap in your medical training, because if you're not a specialist pulmonologist or a specialist radiologist, you often don't get extensive training in how to read chest X-rays from children, especially in the context of TB. So I think that this course helps to close that gap or bridge that gap for your general healthcare worker who is faced with the challenge of having to interpret a chest X-ray and who may have had very limited training before. So I think it is filling that gap, and I think that's probably why it's been so well received. And I think the other thing to mention is that the timing of this course was good. We've just had updated WHO guidance on the treatment of tuberculosis in children, and this includes the option of treatment shortening in children. And the decision to give children a shorter treatment regimen for tuberculosis often relies on how you classify the severity of disease on the chest X-ray. And I think that people have been anxious about how to do that in operational settings. And this course has a module which specifically focuses on deciding whether a chest X-ray is representing severe or non-severe TB. So I think the timing of the course also has something to do with the fact that it's been well received and taken by many people. Yeah, so this course really focuses on interpreting chest X-rays in the context of trying to diagnose TB in a child who has symptoms, so a child who would be classified as having presumptive TB. And it's targeted at healthcare workers working in high TB burden settings. So largely this would be general practitioners, so non-specialist doctors who are often based at primary healthcare facilities or lower levels of healthcare facilities. Sometimes it's nurse practitioners. It depends a little bit on the country context, but it's really general doctors, so non-specialist doctors working in high TB burden settings. We talk quite a lot in the course about the features that are very specific to TB or less specific to TB, and that sort of interpretation of the chest X-ray is really appropriate within a high TB burden setting. So if you were going to interpret a chest X-ray in a place where there was very little tuberculosis in children, the course would be less relevant. So the target audience is your general healthcare practitioners working in high TB burden settings, faced with the challenge of trying to diagnose TB in a child. Your general healthcare practitioner has often had very little training specifically focused on interpreting chest X-rays, especially chest X-rays from children. So very often you have training at medical school, but once you qualify as a doctor, you have really little formal training thereafter. So I think that this course is really useful for people who are interpreting chest X-rays from children as part of their routine practice, and that often in the high TB burden settings, which are generally or very often poorly resourced, that job of interpreting chest X-rays often falls on your general doctors and not on specialist doctors. And so this course really is designed to try and help your general doctor be able to pick up a chest X-ray from a child, systematically decide if the technical quality of the chest X-ray is good enough or not, systematically decide if it's a normal chest X-ray or not, and then systematically interpret the chest X-ray looking for features of TB, and then classifying radiological disease severity. So it's a modular course. It's divided into different modules. So you could do one module and then pause and do another module the next week. And I think that makes things a lot easier for people who are not studying full-time and don't have a full-time job and are just trying to brush up their clinical skills. I think it's really amazing that it is online, accessible to all, and free, because it just means that the cost of the course, or the need to travel somewhere, or the need to access specialist trainers is not an obstacle to people actually receiving this kind of training and accessing this course. So this course is divided into modules, and it really starts at the beginning. So it starts with you picking up a chest X-ray, confirming that it's the correct chest X-ray and the correct date and from the correct child. And then it takes you through a stepwise process of classifying that chest X-ray in terms of whether it's technically acceptable or not, whether it's normal or not, whether it looks like TB or not. And here we focus on some really specific individual features of TB that you can see on chest X-rays. And then it proceeds to helping you decide whether the chest X-ray looks like radiologically severe TB or non-severe TB. And at the end of each of these modules, there are examples of cases, which I think are really helpful, as well as a pre and post test, so you can see whether you've managed to improve your knowledge. And I think really the other aspect of the course that I hope will be helpful to people is just the opportunity to develop confidence. Because I think that a lot of people, including myself, lack confidence in interpreting chest X-rays from children. And so I think that this training will hopefully make people feel more confident when they're faced with having to interpret a chest X-ray from children. And then lastly, I just wanted to make the point that there is also the Diagnostic Chest X-ray Atlas for tuberculosis in children, which was also developed by our team in combination with the union team. And this is a PDF that you can also download free of charge from the union's website, and that you could print. So it's like a mini textbooks, and it has a lot more images, and it uses a similar approach that we teach in the online course. So I think this material together really supports each other and provides additional images, particularly because it's lovely when you're trying to learn about X-rays. The more images, the more X-ray images you see, really, the more confident you feel, and hopefully the better you get at it. So this chest X-ray interpretation course that was developed in combination with the union was actually an extension or development of the Diagnostic Chest X-ray Atlas. And I think it's worth going back a little bit in time and just giving a little bit of history. Is the first edition of the Diagnostic Chest X-ray Atlas was actually written by Professor Rob Gee, who was a pediatric pulmonologist working in the Department of Pediatrics here at Stellenbosch University. And he wrote the very first edition of this atlas together with the union. And they then really wanted to have an updated edition. And so that's how we landed up working with the union. So it's actually a long-standing relationship. We were the same group that did the first edition, although Prof. Gee is now retired. And so we have a long-standing working relationship with the union. And obviously, the union has global reach and has a really great presence in high TB burden settings, and has a good track record with knowledge, developing knowledge around tuberculosis, but also with capacity building, training, and dissemination. And so I think if you really are trying to develop anything regarding TB training and you're wanting to reach the most relevant people, which are the people that are living and working in high TB burden settings, then the union just really has the right reach to access the target audience that the course was aimed at.